we're gonna welcome to all the students that have come in through the waiting room at this moment. We'll wait a minute or so and see if we get anybody else before we start. As a reminder, the protocols for today. My name is Mr. Anicol. If you're not familiar with me directly, depending on how your Zoom screen is oriented, you may see Mr. Lloyd in the lower left corner. I don't know. Do we all see it in the same way? No? On my screen, Mr. Lloyd's in the lower left corner. And then our two guest speakers, Hannah Shear and Jonathan Gray, are here as well. And again, the protocols for today, you are not to have access to your camera or your microphone during the discussion. Although if you do have questions, you are invited and encouraged to please send them through the chat. They will be seen by Mr. Lloyd and myself, and we'll try to work in as many as we can throughout the course of the discussion. If there happens to be a question that you want to know an answer to, and we don't get the chance to ask it during the chat, I'm sure either of our two guests would be more than happy to follow up by email or anything like that. So don't feel like too stressed out if there's something you really want to know that you don't get a chance to ask. These people are volunteering their time today because they care about portraying their roles and the ways that you might be able to sort of follow in their footsteps, or at least see a couple more options that are out there as well. And I see, actually, is there something in the chat already? Just the word no. Excellent. All right. So then probably a good way to start for this morning would be for each of our guests to maybe, we had a little bit of pre-discussion before you kids were in, so they're going to repeat themselves a little bit here, but for the benefit of our new audience, why don't you guys introduce yourselves briefly, and then maybe just to give them a sense of what you normally do, versus what nowadays are. If you could give them a real quick synopsis of what a typical day looked like for you before pandemic, and a typical day looks like for you post pandemic, or not post. I guess we're not post yet. In pandemic, current pandemic. I don't know. There's a prefix. Mid pandemic. All right. So doesn't matter who we start with. Anybody take a pick. John's going to be a gentleman and let Hannah go first.
Yep.
So.
Sure, I'll go first. So good morning, everyone. My name is Hannah Shear, and just quick background, I graduated from Norwin in 2013, so it has been a little while. And I got a biomedical engineering degree at Penn State. Sorry to all of the Pitt fans out there. But now I am working for a medical device sector, I guess you could say, of Johnson & Johnson. It's called Biosense Webster, and we make a medical device or medical system that is used in a specific type of heart surgery. It's called a cardiac ablation. And basically a typical day for me, I am a clinical account specialist. So I go into the hospital every day where we do cases. I go into the procedure and I sit down with the doctor. We kind of go over the procedure and what we're going to do. And basically I sit on a computer monitor, and as the doctor completes the surgery and is using our medical device in surgery, I actually use our system software to kind of collect data and create a 3D interactive map of a heart, of the patient's heart, and the doctor and I kind of interpret it together. And basically I'm making a model for them to kind of best decide how they're going to treat the patient. Oh, and I guess now that I'm in pandemic, so as a lot of you might have heard on the news, most hospital systems are not doing elective procedures during the pandemic. So a lot cardiac ablation procedures are considered an elective procedure. So we're doing a very small amount across the country. Basically, if it's a life-threatening kind of condition for the patient, or if it's a patient who's been in the hospital for a while and they need to free up space for medical equipment, beds for people in need or in demand. So I've actually not been working in the field. I haven't been going to hospitals. Some of my coworkers have been on a very limited basis, but I have, for the most part, just been at home, working from home. I have my little office set up, and I have been, kind of learning as much as I can. We have kind of like refresher courses and things for everyone to stay engaged, conference calls, lots of Zoom calls, but lots of Netflix.
Yeah.
But yeah, that's pretty much it.
Awesome. Thanks, Anna. Thanks. All right, John, how about you?
All right, hi everybody. I'm John Gray. I'm a physical therapist for UPMC Centers for Rehab Services. I'm in the Forest Hills office. So I'm a 2011 graduate from Norwin, so even a little longer ago than Hannah. And basically what I do is I help people get better, recover from injuries. I'm in the orthopedic setting, so that means I'm mostly dealing with injuries related to things like the back, shoulders, knees, ankles. Pretty much if it's somewhere in your body that's on the outside, that you can describe on the outside, not on the inside, I can try and fix it. So if you're all familiar with physical therapy, it really is a combination of exercises and other what we call manual techniques. So things that I'm going to do in terms of stretching or moving a body part to help improve things like pain or ability to move, or things that we like to call functional goals, like things that you want to do. So it could be anything from returning to a sport, or if it's someone who's maybe a little bit older, being able to walk independently. So basically pre-pandemic, my day consisted of a pretty normal 5 days a week office setting. You come in and I see patients throughout the day. Like I said, various injuries or various, things going on. And kind of in the middle of this, we, by the state of Pennsylvania and by, most states that I saw, or most places that I've seen, deemed physical therapy essential, because we're, our vital role in the healthcare system during this situation is to keep people out of more severe settings. So in other words, we don't want people right now going to the hospital because their back hurts. We want people only going to the hospital because, they absolutely need to. It's something more life-threatening. And what we can do as physical therapists are help keep those people, their pain at a more manageable level that doesn't require them to go to the hospital, and helps free up those beds for other people. So we've stayed open. Definitely volume has fallen off. We've seen, a lot less people over the last few months, but it's good. It'd be interesting to see that, now that within this area, as UPMC and some of the other health systems are starting to try and revamp and get back into doing a lot of more procedures and a lot more things, we should see an increase in volume again shortly.
Oh, thank you. Mr. Lloyd, how's your post-pandemic life going? We'll give him a minute. Oh, there he is.
I can't see, so I was having trouble finding myself and unmuting myself. Pandemic life is, it's pretty consistent. We're, making assignments, grading papers, creating new work that's usable online. So, that sort of thing. I enjoy this. This is a nice diversion. And,
yeah, it's nice to talk to.
I'm glad to see some students signed in for it and everything.
Yeah, absolutely.
And it's good seeing you guys too. I mean, it's been years and years, it seems, since I've had you guys in my class. But by the same token, it doesn't seem like it's that long ago. When you said 2013, 2011, it was like, wow, was that long ago? So,
they still both look so young.
And I didn't take too much offense whenever you said that, the physical therapy was for older folks, because
No, I said it's skewed older. Not exactly. Not only.
All right. Well, the sort of the theme that sort of brings you guys together as we sort of thought about the idea of like medical careers a little outside the mainstream. I know there's a lot of physical therapists, but when we put it in the scope of like doctors and nurses, you guys, and especially biomedical engineers, you guys form a smaller percentage of the overall workforce. So a lot of kids that, a lot of people that go into doctors and nursing programs, sort of have had a role model that sort of encourages them to do it, or there was a TV show where they saw something they were excited about or something like that. Do you guys want to give a little bit of background, like how you guys ended up where you are, like what inspired you to pursue your field, since there were probably less role models around you and in the media to pick from?
Yeah, sure. So I can go mine real quick, because mine's pretty simple, and it actually is from talking to people and getting to other physical therapists, it's really a theme with this, is usually people don't know they want to be a physical therapist until they have to go through physical therapy, and they kind of have the life experience of seeing it. So for me, it was my sophomore year of high school. I blew out my knee, tore my ACL, MCL, meniscus, and had to go through 5 months of pretty extensive physical therapy afterwards. And it was kind of in that moment that I was like, you know what, this is something I could see myself doing for the rest of my life, because the benefit of physical therapy as a career is it's a great way to kind of help people within the healthcare field, but it's not, I've always said that the hardest part about being a doctor to me that I would think about like a medical doctor would be, you really ride this emotional roller coaster of when you get somebody better, it's a really high. When you get but when someone, you say you lose someone or, and that happens a lot in the medical field, then that's just a really emotional, that's a hard thing to get over. And the great thing about physical therapy is I feel like you get to stack up a lot of wins without a lot of really significant losses. And so that's what it really got my attention right away, because, I had a great physical therapist that I worked with my knee, and I thought this is something I could see myself doing for the rest of my life.
Thanks, John. Thanks. How about you, Hannah?
So for me, I didn't really have, I guess, like a personal event or something that, made me want to be a biomedical engineer, but I was actually really indecisive when I was choosing a major in high school. I really had no idea what I wanted to do. I knew I was really good at math. I really liked physics. A lot of my classmates were going to be engineers, and I was like, oh, that sounds good. I don't know. But I really wasn't totally sure. I wasn't totally sold on it. I knew, also that I have some healthcare workers in my family, some nurses, pharmacists, people like that, and was kind of always drawn to healthcare. And part of me considered going to medical school or going that route with a very clinically based role. But since I did really like technology and math and things like that, I kind of decided to combine the two. So biomedical engineering was a bit of a happy medium, I guess, just because it is a very diverse field. And as someone who wasn't totally sure, but kind of knew what things I liked, it kind of was a good route to take, because a lot of people that I graduated with did go to medical school. So that option was still always there if I chose to do so. Some people go into industry, some people go and pursue a PhD and do research and like cancer research or tissue engineering or something like that. So it just kind of left a lot of options open. But I know for me, I always, wanted to be in a career where I felt that I was really directly helping people and kind of improving people's lives, which engineers, I guess you could say, solve problems. And I like that I've kind of ended up in a role where I'm able to go into the hospital every day and really see, the technology that my company comes out with actually work and, be used to improve the lives of people. And I see that very directly every day. So for me, it's been, really rewarding, and I'm really happy that I chose to be a biomedical engineer.
That's good. So in the context of what Hannah was saying and John mentioned too, is, you guys both mentioned the fact that you're basically working on teams. You're working as part of a large organization. When you're working with professionals from other fields, what do you feel? I mean, and they're educated professionals and stuff like that. What do you feel they come to you with as what's the most common misconception about what you do that you get from other medical professionals that you interact with?
So mine's super easy. It's most people have no idea it's a doctoral program to be a physical therapist. So even down to like MDs that are sending people to us, I've come to find out over the years that for the most part, they believe it. A lot of them believe it's a bachelor's degree, or some don't. And the part of the problem with that is that it's a field that's evolved a lot over the years. So in the 80s and 90s, in early 90s, it was a bachelor's degree. It was a 4-year degree to become a physical therapist. That's what it was. And then they increased that to be a master's program in, I think it was the mid to late 90s, depending on where you were. And then they actually increased it again to be a doctoral program now. So as part of that doctoral program, I have to do stuff. I had in my course of my education, I had to do classes on medications, even though I can't prescribe them. A lot of things about differential diagnosis of diseases that I will never treat in my entire life, just so that I know not to treat them. So in other words, if someone comes in and, the side of their right side hurts, I have to be able to differentiate whether it's a pulled muscle or whether I think, they're a couple minutes away from their appendix exploding. So that's all part of what encompasses our education. And a lot of people, even within the medical field itself, aren't aware that it is a fairly, advanced degree, and there's a lot of information that a PT might know that you might not expect them to know.
I don't know. I think specifically in my field, I work directly with surgeons and also like their staff, like nurses, techs, things like that. I think the misconception among, I guess, my particular role is kind of that we're just the people that kind of drop in for surgery and we just kind of come in all smiling and nice. We're like the happy representative that comes in for my company, and then we just kind of leave and go home. So I think sometimes people, like don't always take us totally seriously, just because we're kind of a representative to the hospital. We're not an employee of the hospital. So sometimes you have to stand your ground a little bit and kind of just come in and be pleasant. It is a very customer facing role, and just kind of do what you need to do and make everybody happy, I guess, and just keep a positive attitude. So
thanks. And again, students who are listening in, feel free to, as our guests are speaking, feel free to start dropping questions in the chat, and I'll work them in as quickly as I can. Now, since you guys both come from fields that maybe the kids don't know about as much, again, they have a sense of what you do, in sort of a typical day. Are there a variety of ways to be the degree that you are, or are you sort of like just you're like the one route? Or is there a lot of different ways to be an active member of your field besides the way that you guys are doing it right now?
I mean, I think in my experience, I definitely, like my job is not the only way to go. I think maybe it's even a less common way to go. I think with engineering, it's very broad. Even if you choose a specific specialization like biomedical engineering, maybe it's a little more focused than say a mechanical or electrical engineer, but still the different routes that you can take are very different. I know personally when I was in college at Penn State, when you went into biomedical engineering, you kind of defined the route that you wanted to take. So I had like a mechanical focus. You could do an electrical focus, you could do a chemistry focus or a material science focus, because there are a lot of different ways that you can go. I mean, some people go into more of like a tissue engineering, like I mentioned, or some type of medical research. A lot of people go to medical school. People that go into industry, some of them have, a more traditional engineering role, like maybe they're working on designing a device or testing a device, maybe a project manager, something along the lines of developing technology. I'm more on the tail end of it. I'm more of like the customer facing person that's, promoting technology and using it in the field to kind of improve outcomes for, the people that we're operating on. But yeah, I definitely, there are so many different ways to go. And I think when I, graduated from high school and was going into biomedical engineering, I had no idea even, what options were out there. I had never even heard of the job that I have now. So there's definitely a lot of different ways that you can go. You're not stuck just, doing one thing, and you can always change it up too.
John, how about you?
So yeah, for physical therapy, there are a ton of different ways that you could take it once you have your degree in physical therapy. The field is immense. I mean, first of all, you have just the differentiation between being either outpatient or inpatient. And what that means is inpatient, you're going to be working in a setting where the individuals you're treating live there, or at least staying there. So that's anything like a hospital. You have skilled nursing facilities, long-term rehab facilities, anything like that. That's all just under one umbrella. Then you can get into the outpatient field, which is where I am. And within outpatient, that means that you're a freestanding place that people are going to come to you to get treatment. And within that, there's also a bunch of different ways you can branch off. I mentioned on the outset that I'm more of someone who deals with orthopedic issues, but you can go anywhere you can get into neurological physical therapy. So things like what people go to maybe after they've had a stroke or any sort of brain injury. Within that, you have a subspecialty of concussions, people who deal with almost entirely with concussions. That's a growing field right now because of all the research there. You have things like women's health. There's physical therapy, a whole division of that. There's aquatics-based physical therapy. There's even so much, I wouldn't get into the field just for this because there's not a lot of jobs for it, but there's animal physical therapy. I know somebody who does physical therapy on horses, so there's a lot of different things you can get into. And even within, one of the coolest things about physical therapy is once you have the baseline education on it, you can do just about anything, but you're only going to get good at the things you practice. So in other words, I have the skills to treat, a all-pro football player for the same injury as I have to treat an 88-year-old man who broke his hip last week. The difference is if you see one more than the other, you're going to be a little better at one than the other. But, it's once you have that skill set, you can take it to 100 different places.
Nice. Okay, cool. Lots of flexibility in both regards then. Good. We have our first question from the chat room. I'm gonna tweak. Yeah. I'm gonna tweak it a little bit. Why don't you guys share in your college or undergraduate education, now Hannah, yours wasn't a graduate program. Yours was a straight bachelor program.
No, I just have a bachelor's degree.
So and not a just Hannah. That's still very impressive in biomedical. So, it's from Penn State, but that's okay. But so the question would be, what was your favorite course that you took college or graduate school, and what was your least favorite or worst course?
Oh, I know my least favorite right off the bat. Well, it wasn't my least favorite. It was actually probably one of the more relevant to my current field, but it was just really hard. My least favorite class was called Biofluid Mechanics. And I think most engineers will tell you that fluid mechanics was their hardest class, but in a lot of other types of engineering, your biofluid or your fluid mechanics is, you have a pipe with like water or oil or some kind of like regular nice fluid flowing at a constant speed through a pipe. Whereas for biofluid mechanics, you have a blood vessel that's like teeny tiny with blood, a very irregular viscous fluid going through it at some random pulsatile, is a mess. Very difficult. My favorite class, honestly, I loved math, so I really liked my calculus classes. I think math was always kind of my strongest subject, like all through high school and college. But I had a class I really liked. And it was actually kind of like this. It was like once a week we met and a biomedical engineer would come into our class and talk about kind of their journey through biomedical engineering at Penn State and like where they went and what they do now. And it was really interesting to kind of see the diversity, especially because I think when you're a student, you don't really fully understand, like what options are out there. I mean, some people, and if this is you, that's awesome. I wish I had been like this, like know exactly what they want to do. And I didn't. So I think, going into applying for my first job, it was really nice to kind of hear about things that I was really interested in and maybe didn't know about. And also even to hear things where I'm like, I would never want to do that. And, it's kind of helped out a lot. So that was probably my favorite.
Oh, hold on, John. I muted you. Hold on. Give me hold on. I got to find you in the queue. No, I'm gonna go right here. All right, there we go. All right, sorry, John. Go ahead.
That's okay. That's okay. So my degree, the way it was structured is there's a couple of different routes you can go for physical therapy depending on what program you're going to. But mine was I had to have a four-year degree or a bachelor's degree in something science related first, and then get accepted into a grad program and go there. So basically it was 4 years undergrad, 2.5-ish years for grad, really closer to 2 for grad school. So for undergrad, I'd say my favorite class was actually one of my more challenging classes, and just because I had a really great professor for it. And that was organic chemistry. Was usually really, really hard, but I had a really cool professor for it, and I really liked that. And then the other class that I really enjoyed just because my degree was biology. I did enjoy like my biology 1 and biology 2 classes. And little side note there for anybody that's, in school, you know, any of you guys thinking about what classes you're going to take in the future and stuff, I would very much recommend, if you're someone who's tending to lean and you think you have an interest in anything medically based, if you have room in your schedule when you get to that point, AP Bio, it's really hard. I mean, it was a really hard class for me in high school, but I benefited from it immensely when push came to shove for time for college. Like, I didn't struggle with biology at all once I got to college, because I felt like I had a lot of the skills I needed already for that learning. But that's just a little side note on that. As far as the worst class for undergrad, my undergrad degree, I would say, you know, I'm going to break Mr. Anicle's heart here, but like physics 2 was rough. It was a rough road, just because like electricity, just the way my mind works, like electricity is basically magic to me. And to this day, I kind of don't feel like I fully understand everything about that. So that's just a personal thing though. But that was probably one of my harder classes that, and in fairness, it was relevant to me, and I used stuff I learned in those classes, so it's not like there was no point to them. It's just that was the way my mind worked. And then it's hard to say favorite and least favorite class for grad school, because they're kind of, the classes are structured differently, and that it's all about what you're doing. So like it's all PT related. So like I had, you know, classes that were just called like musculoskeletal, which is learning about the body, and neurology, learning about the brain, you know, things of that nature. So really of that, it's kind of more just like what you found interesting versus what you didn't. And I was always somebody who was more inclined for the muscle and, you know, the nervous portion of the body, muscles and nerves, more than like we have a cardiopulmonary unit. And that was a little bit outside the field of what I felt. You know, it's important information, but that just wasn't what I was super interested in.
Good. We're getting a little dog background noise here in the end class. That's all right. All right, that's good. Good. All right, another question coming in from the chat room, and again, I'll put a little spin on it there. Let's imagine you guys have like a LinkedIn profile and stuff like that. Like if you had like a one-line space to define your specialty, what would you define your career specialty as? If you had one sentence to define your career specialty on LinkedIn.
So I know a lot of PT, it's with orthopedics, we have our professional organization has a saying, and I can't remember it verbatim now, but it's something along the lines of like improving lives through pain management, motion, and functional activity, or something along those lines. So basically, I think what I would spin that to myself to make it more layman's terms is helping you do the things that you want to do better and without pain. That's kind of what I would say PT is, and what I pride myself on my ability to do, is make you feel less pain while you do the things you want to do.
Okay. How about you, Hannah?
I don't know. I think I would say something along the lines of, you know, using, you know, advancements in medical technology to, you know, improve the lives of patients. Something along that line. I think, you know, that's kind of the main focus of my job, is that as the medical field is quickly advancing and coming out with all this new crazy technology, like your Apple Watch telling you that, you know, you have a heart problem or something like that, you know, I think there's a need to kind of understand these devices and how they work, and kind of be the bridge between, you know, the engineer and the customer. So
neat. Good. I think that might have been more than one sentence, Hannah, but that's
yeah, sorry. My first sentence. It was one.
Another question from the chat involves specifically like the math courses. Like if somebody was to pursue your career, what kind of math courses would they expect to take? And I'm going to extend the question a little bit too. Would you have any advice, like in high school, that kids could do to start getting ready for that course of math that they would be taking?
Yeah, so any engineering route, you would take calculus. I took calculus 1, 2, and 3. And then and your classes in general use a lot of calculus. Like physics is no longer like algebra based, it becomes calculus based. And you just kind of use it in your classes all the time, especially as you get to like your junior and senior year of college, when it becomes, you know, it's not like general calculus, it's like, you know, calculus applied to the human body or something like that. For me in high school, I'm not, I don't know how the structure has changed since I've left, but I know that I was always in advanced math. Like I always took it like a year ahead or something. Like I think when I was a senior, I took Calc 2.
Yeah, that's about where we top off. Yeah, but still about Cap D.
So I mean, I tried to get as involved as possible. I don't know. I always would do all of the practice problems in the back of my textbook because I'm kind of a nerd. But yeah, I don't know. I don't know. I would say my advice is to definitely, if you want to be more involved or, you know, need practice or something, definitely always talk to your teachers. See how you can be more involved. I don't know. I know we used to have, when I was in high school, they had like a quiz team or, you know, things like that where you could get a little bit more involved outside of the classroom. But I would say if you are wanting to do anything engineering related, definitely, definitely calculus. Yeah, but now in my current job, I pretty much like divide fractions and that's about it.
So for my program, I only had to go to Calc 1 for the degree I was going for, and I was able to substitute a lot of PT programs either want Calc 1 and a stats class or Calc 2. I would say just personally, from my opinion, I think as a PT, me and others I've talked to have gotten more out of like a good stats class. Especially if it's I know there's certain places that offer a stats class, and it's worded differently, but there's stats classes that have an eye towards like science and breaking down scientific data as opposed to other kinds of stats. And I would definitely recommend that if that's an option. Because not that stats 2 isn't important, but just kind of like what Hannah said, my job, I'd be lying if I said I used a high degree of like calculus on a daily basis at my job. You know, a lot of it's counting low level numbers for people with the reps they're doing. But it's important to have, as a baseline number, and especially with the stats, because you definitely have to do a lot of research and you read a lot of articles and things like that in PT school and as you become a physical therapist. So it does help if you have a little bit more of a critical eye towards statistics, and you usually will learn that in a class. That's the biggest math thing I think for a PT.
All right, nice. Another question from the chat, asking about what's the hardest or most challenging part about your job?
So I'll good if I go, Hannah?
Go ahead.
Okay.
Yeah, go ahead.
It's always like feel like you're stepping on somebody's toes when I start talking. But I would say the hardest part of my job is the fact that much like I think most things in the medical field, results aren't guaranteed. So you have to go in with your patients with an open and honest conversation about, you know, what their goals are, what you're going to work towards with them, and then the effort they have to put in as well. Because PT, you know, a big part of it is teaching, you know, helping people get better, but a lot of it does fall on the individual to do the work, you know, outside of the time that they're with you. And some people are really receptive to that. Others aren't so much, but there's nothing more difficult than when you see somebody doing what you feel are all the right things, and you're doing what you think should, and sometimes it's just as the human body works, sometimes you're not getting the results you're looking for, at least right away. And that's the most challenging thing, is getting people to push through those moments. And the thing I fall back on a lot when it comes to physical therapy is, as far as a medical intervention goes, there's always pros and cons. There's risks and rewards. The biggest risk in physical therapy, generally speaking, is that you're not going to get exactly the results you want, but you're going to come out stronger and in a little better shape. And I always tell people that's a pretty good risk. Like, if that's the worst thing that's going to happen, that's not too bad. That's not too bad. But that's the challenge, is not always seeing the results you want.
Makes sense.
Yeah. I mean, mine's kind of similar. I kind of have like a two-part. The first part being, I mean, my job is very clinically based, and I, you know, have a bachelor's degree in engineering, which it is biomedical engineering, but I pretty much had to learn how heart surgery works. I had never really walked into a hospital ever. I didn't know, you know, how they put a patient to sleep, or how they, you know, prep a patient, or, just I have to now like read EKGs on a daily basis and say like, oh, that doesn't look right. So it was definitely a really steep learning curve. So that was definitely a challenge to kind of, you have to have the technology background and knowledge and be able to use it in a surgery, but you also have to know what's going on. So that was definitely, a difficult thing starting out for me. I'd say on a day-to-day basis, I mean, it really, you're in surgery. It's not a risky procedure per se, but it can be if things go wrong or sometimes out of your control. But you kind of always have to be there for the doctor, and you are really like their trusted advisor. They are constantly talking to me and saying like, where am I? What am I? And I have to know, and I have to be able to respond. And sometimes a surgeon will get frustrated because something's not going right, or they can't, they can't get to a place that they want to get to, and they start taking it out on the person closest to them. So, sometimes you have to kind of, expect that you're going to be in a little bit of a high stress situation and be able to calmly, talk through it and just kind of be positive and, always be on your toes. But I think, having an engineering background has helped me with that, because I really learned a lot about the system itself. So if something happens technology related, I am like up off my chair, like running around, like fixing wires and things, like as the surgeon is operating. So, more just like preparing for high stress situation.
No, I get it. Absolutely. Absolutely. Good. And if you guys ever want to bounce in on something the other person says too, feel free to cut me off before I move on to the next question and stuff like that too. Another question from the chat. I'll paraphrase slightly, but what is the if you're able to discuss it without violating HIPAA, the weirdest or most unusual moment you've had in your job? How's that?
Oh, all right. The best one is. So a lot of mine, usually if the weirdness comes down to how people hurt themselves in really odd ways, like the things that people can fall off of that you didn't think they could fall off of and do like serious damage, and both impressively and unimpressively. Like I've seen people like fall off roofs and be pretty much, and they're like, oh, my shoulder just hurts a little bit. And then vice versa. Somebody comes in like a full cat, like 3 different body parts injured, and their arm, shoulder, and I said, what happened? And it's like they tripped walking on a flat surface and just kind of like bit it hard. So that's usually in my, I mean, I've seen some weird kind of like bones and muscles if somebody's living with something for a long time. So say somebody's had arthritis in their knee for 30 years, and they just kind of keep doing whatever they're doing and pushing through the pain, and it's not really bothering them. I've had people come in with, your body will adjust to that. So you'll actually like grow additional bone in different places, or like you'll calcify muscle or do different things. And I've had people walk in with what looks like a second knee off to the side of their first one, just from like bone growing somewhere it shouldn't. And people, I mean, if there's nothing else to take away from science fields in general, it's that the human body is just insane, and what it is and is not capable of doing, and basically the way it can cover for itself and the things it can hide, until you start to kind of like fall apart a little bit, and then it's like a car. Once one thing starts to go wrong, everything does. So that's pretty much the weirdest things I see, are like places that they don't belong.
Yeah, I mean, I don't have anything that, pops into my head for like the weirdest thing I've ever seen, but I've definitely been in situations where, maybe someone else in my position, like someone on my team, will call me and frantically kind of be like, we're in the middle of a procedure and like something's not working and blah, blah, blah. And I'm like, did you plug it in? And they'll be like, yes, I plugged it in. Like I've been, doing this job for 20 years. And I'm like, did you plug it in? And I'll hear a pause. And then like so like it is kind of amazing in these situations, like you think all these crazy things are happening, and a lot of times it's just people are stressed out, and usually simpler than you think. So
excellent. All right, now I know I had you guys booked till around 10:45, and I know you guys might have other things coming up in your schedule, so we've actually cleared all the questions from the chat docket, so that's good. So I'll I'll wrap up with a question here and make sure you guys get on your way on time. And I would say, if you had, let's go with the classic. If you had one piece of advice that you could offer, like yourself, like while you were still in high school, what would that piece of advice be? In fact, I'll even split it up. One piece of advice and one warning. How's that? So, what's it? Something you should do and something you shouldn't do. Well,
so I would say the piece of advice would be to try, especially when it comes to like classes or things like that, try things outside of your comfort zone and outside of what you feel like you think you know and what you think you want to know. Just because a big part of, especially with physical therapy, and I think this is true in anything where you have to deal face to face with people, you learn a lot from the class itself, but what you also learn how to do in a lot of those classes is learn. You learn about learning, and you learn about talking to people and all these interpersonal skills that, you think just come natural, but until you're stuck in a room with somebody who wants nothing to do with you and really doesn't want to talk that much, it takes a certain way to talk to that person as opposed to, super friendly person. So really, I'd say just kind of like, I'm not gonna say overextend yourself, but put yourself out there would be the advice I gave myself. And then the warning would be, don't be too hard on yourself because it's easy, especially if you have these big lofty goals. Like for me, it was different. I was that weirdo that kind of knew what he wanted to do from the very beginning. And a lot of people, that's much more the exception than the rule. And I always knew I wanted to be a PT. And I know that it's a hard road. And there's a lot of places that you can a lot of pitfalls and a lot of places that can fall off. But in the same breath, like, you don't have to be perfect. Doctors aren't perfect. If you take a class and you're having a hard time with it and you get, a B- on a test, you get a C+ on a test, that doesn't mean quit. It doesn't mean give up. It doesn't mean you're dumb. It means, maybe just try something a little different next time, or do it. If you feel like you can do better, figure out how to do better. If you feel like you gave it your best, then that's the answer too. And I think, as people who go into medical field, I feel like they have a tendency to be a certain type of personality. Maybe they'd be described as a type A, is how they'd say it, or whatever the verbiage is on it now. And there's a certain expectation of yourself to like know everything and be good at everything. Just be nice to yourself, I guess is the best thing to say.
Yeah, I think for me, my best advice is honestly, it's kind of cliche, but just like really believe in yourself. I think I always kind of struggled with that. I always never thought I would be like smart enough to be an engineer, or like I was always kind of doubting myself and thinking like, I don't know if I can do this. It kind of sounds scary or hard or whatever, but it really is mind over matter and having a positive attitude. And, like John said, not everything's going to come easily. But you kind of just have to keep trying, use your resources, keep pushing yourself, and things work out in the end. I don't think when I was your age I would have ever seen myself doing what I'm doing. So I mean, it really is, you just have to have a positive attitude. I wrote down a quote because I was thinking about it. It's kind of a warning, but kind of a quote, or a good positive quote. But if you're the smartest person in the room, you're in the wrong room. I think there's always something to learn. I think there's always, I will be the first to say that sometimes I always thought, coming out of high school, I thought I was like so smart and I was like ready to go. And then you get to college and every person was the smartest person at their high school. And it's really kind of like an interesting kind of perspective to have, to think that like you always have something to learn from someone else. Everybody's in a different walk of life. Everyone, has different assets that they bring to a team. So I think, sometimes it's better to listen than it is to talk. So that would be my warning / advice.
Awesome. Well, again, I super appreciated you guys taking the time to speak with us today. I think it's neat how, even though you guys have very, very different backgrounds, I think you guys have, a lot of experiences in common to a lot of extent, a lot of advice in common to that extent. And I thank you for the work. Thanks for the education that you guys put in to get where you are today. I know Hannah, it doesn't feel like right now that you're you're able to help out as much, but it's there'll be a time when we're happy to have you in the OR again. And John, thanks for being out there every day doing your job in a no doubt a doubly stressful environment with what's going on too and stuff like that. We'll let you guys get back to your days and stay safe. And thanks again for your time. And Mr. Lloyd, thanks for riding shotgun with us today again.
My pleasure. And thank you guys for joining us this morning. I enjoyed listening to your comments and also really enjoyed listening to your advice that you had for high school kids. I think that's very important for kids today. And speaking on my own behalf, I continue to learn from my students all the time. So, even though I've been doing this a long time, I still try to learn every year.
Yeah.
Have a great day. Have a great weekend, everyone.
Yeah, thank you. Thank you for putting this together.
Oh, no,
Yeah,
thanks.
yeah.
Couldn't do it without you guys. So, thank you.
All right.
Have a good one, everybody.
Thanks. Have a good one.
Sorry,
Good.
my microphone is a tangled mess right now. I'm trying to.
Oh no, it's okay.
Problems of pandemic life, I guess.